This is MeetSean, where we break down real life topics insurance, annuities, real estate, travel planning, and home ownership so you can make smarter moves. Subscribe so you don't miss the next episode.
Every single year, the data confirms what we already feel in our wallets, right? Healthcare expenses are just they're rising relentlessly.
They really are.
And it doesn't matter if you need, a quick clinic visit or you're facing a sudden medical crisis. Without a plan, that care comes with a price tag that can be catastrophic.
Yeah, we're talking about bills that can stretch into the tens or even hundreds of thousands of dollars.
Yeah.
Easily.
Okay, let's unpack this. Our mission today is to explore the specific mechanics of health insurance. We're going to do a deep dive into the sources to understand exactly how this system is designed to act as a firewall.
A financial firewall.
Exactly. Protecting your financial life from those unpredictable costs and, crucially, making sure you can actually afford to get help when you need it most.
And that financial protection, that's the key takeaway here. It's why really getting this topic is so essential for everyone.
Right.
When you look at the economics of it, the core function of insurance is actually pretty simple. It's a risk transfer mechanism.
Okay, risk transfer.
Yeah, it takes that huge, unpredictable risk of a massive medical bill,
Yeah.
and it transforms it into a predictable, managed monthly expense, your premium.
So it provides that safety net.
Necessary safety net against, potential economic ruin.
So let's start there with that foundational role. We often think of health insurance as this big, complicated thing, but you're saying it really just boils down to one simple action.
It does.
Acting as a buffer between you and the full crushing cost of modern medicine.
Precisely. Without insurance, every single dollar that's billed is on you. With insurance, that whole equation just
True.
it fundamentally changes because the risk is shared.
So the insurance company steps in.
They step in and accept a shared role in covering those costs. And it's not just for the big, scary stuff, though that's obviously critical.
Mm.
The sources confirm that coverage is designed to handle all these major expense categories. So your daily things like doctor visits and prescription drugs.
The routine stuff.
Your routine stuff, but also those huge financial hazards like a long hospital stay or a specialized surgery.
And what's so fascinating about that is the shift in responsibility.
Yes. By spreading the risk across a huge pool of people, no single person is left to shoulder the crippling cost of an expensive event on their own.
It's all about pooling the resources.
That's what makes healthcare so much more affordable and, maybe more importantly, financially predictable. It's essential for budgeting.
Here's where it gets really interesting, though. When most people think about insurance, they think about the break glass in case of emergency scenario, right?
Yeah, after you're already sick or hurt.
Exactly. But the documents we looked at highlight this huge proactive benefit that I think it's overlooked, the value of prevention.
Oh, absolutely. The forward-thinking value here is that insurance actively encourages you to stay well.
How so?
Well, today, a lot of policies, especially ones under the Affordable Care Act standards, they mandate that essential preventative services.
Like an annual physical.
Annual physicals, health screenings, immunizations.
Yeah.
Those things have to be covered at zero cost to you. No copay, no deductible.
And that's not just the insurance company being nice. There's a reason for it.
Oh, it's sound economics.
Yeah.
For everyone, think about it. Catching something like diabetes early during a free checkup is vastly cheaper than treating a stroke 10 years later. So by removing that cost barrier, the insurer reduces their own risk of paying for a really complex, expensive condition down the road. It's a true win-win.
So it turns insurance into a tool for proactive health management, not just reactive treatment.
Exactly.
I think that connection is key, that the insurer actually has a financial incentive for you to stay healthy. But, let's face it, life happens.
It does.
We still need to talk about that financial disaster potential, a broken leg, a sudden cancer diagnosis, things that can generate a $30,000 bill in a few days. How does insurance shield us from that?
Okay, so this is the core mechanics part. And understanding these three specific features is what separates being generally informed from being well-informed.
These are the levers.
These are the financial levers that slash your out-of-pocket costs. The first one, and it's often totally unseen, is negotiated rates.
What does that mean exactly?
Insurance companies use their huge customer base to demand discounts from hospitals and doctors. The sources show these deals can cut the billed price, the price an uninsured person pays, by something like 40 to 70%.
Wait, hold on. So if a hospital bills $1,000 for an x-ray, the insurance company has already knocked that down to, say, $400 before I even see the bill.
Exactly. And that $400 becomes the allowed amount. That's the number everything else is based on.
Wow.
So after that baseline is lowered, the second set of mechanisms kicks in, the cost-sharing features. This is your deductible, your co-payments, and your co-insurance.
Let's break those down because they get confusing.
They do. Okay, so the deductible is the gatekeeper. It's a fixed dollar amount, maybe $2,000 or $5,000, that you have to pay out of pocket for covered services first.
Before the insurance really starts helping with the big bills.
Right. Once you hit that deductible, you enter the world of co-insurance. Now, this is different from a fixed co-payment, which is that predictable fee for a doctor visit.
Coinsurance is a percentage.
It's a percentage of the remaining bill. So if your plan is 80-20, the insurer pays 80% of the allowed cost, and you pay the other 20%.
Okay, that distinction is crucial. And that 20% slice could still add up really fast if you have a $50,000 surgery.
It could, and that brings us to the third, and I would argue the most important feature, the maximum out-of-pocket limit, the OOP max.
This is the ceiling.
This is the ultimate cap on your financial liability for the year. This is where protection goes from shared risk to total coverage.
How does that work?
It's simple. All the money you pay for your deductible, your co-payments, your co-insurance, it all gets added up and counted toward this OOP max.
Okay.
Once you hit that cap, let's say it's $8,000 for the year, the insurance company starts paying 100% of all your covered medical bills for the rest of that year. You pay nothing more.
Nothing. Even if you rack up another $200,000 in costs.
Zero. That is the financial anchor of the entire system, is the guarantee against financial catastrophe.
For a family dealing with a chronic illness, that number must be, that's everything. It gives you peace of mind.
Unparalleled peace of mind. You can actually budget for the worst case scenario.
So now that we get how the Shield works, we have to talk about picking the right one. The sources really emphasize that choosing a plan is a delicate balance, isn't it?
It's a fundamental financial trade-off. It's about your health, your budget, and your personal tolerance for risk.
And we see two main approaches.
We do. On one side, you have plans built to offer the lowest possible monthly premium, that bill you pay every 30 days.
These seem to appeal to, young, healthy people.
Right. People who don't expect to need much care. But, and this is a big but, those low-premium plans almost always come with much higher deductibles and higher max out-of-pocket limits.
So you save money month to month.
But if you get seriously sick, you have to pay a much larger amount out of your own pocket before that full coverage kicks in. You're basically gambling on staying healthy.
And what's the flip side? For someone who knows they have medical needs or a family with young kids.
For them, a higher monthly premium might actually be the smarter financial move.
Why is that?
Because those plans, the ones with higher premiums, they usually give you much lower deductibles, lower copays, and a lower overall maximum out-of-pocket.
So your monthly cash flow is a little tighter, but your risk in a crisis is much, much lower.
Exactly. And you also have to look at networks. The sources talk about ACA marketplace plans versus private health policies. That choice often dictates your access. An HMO might be cheaper, but more restrictive.
Well, a PPO gives you more flexibility to see specialists, but costs more.
Precisely. So if you know you need to see 3 different specialists, you might be better off paying that higher premium for a PPO plan with broader access.
Yeah.
You're paying for control.
If we connect this to the bigger picture then, the real benefit of health insurance is transforming that chaotic, unpredictable fear of getting sick into a predictable line item in your budget.
It's financial de-risking. It lets you focus on getting well instead of on how you're going to pay for it.
So what does this all mean? When you're looking at plans, you have to look past the premium, that maximum out-of-pocket limit. That's not just a number.
No, it's the definitive ceiling on your personal financial liability for the year. It is the ultimate guarantee. If you know that number, you know your absolute worst-case financial risk.
That's the bottom line.
It is. And this brings up a really important question for you to consider as you compare your options. Since the real goal of insurance is protection from financial ruin, and since every dollar you pay brings you closer to that point where the insurance covers 100%, does prioritizing the lowest possible maximum out-of-pocket limit, even if it means a higher monthly premium, truly represent the highest value in protection?
So it's a question of what you're really insuring against.
Exactly. Think about that balance. Are you insuring for the routine, or are you insuring for the worst-case scenario?
That's it for today's Meet Sean. If this helped, follow the show and share this episode with one person who needs it. See you next time.